The Federal Ministry of Health therefore supports the move by this Honorable House to amend the NPHCDA Act in line with the current realities and the needs of the agency and of Nigeria. Working with our development partners, donors, civil society organizations, we shall continue to keep our promise of changing the face of primary healthcare delivery in the country, which is the foundation of all healthcare delivery. We have made all this progress with visionary and passionate leadership provided by the President of the Federal Republic of Nigeria. Thank you, Mr. Chairman and honorable members, for this invitation to be part of this discussion.
I want to call on Honorable Tajuddin. Please tell us why you think we should, what made you to sponsor the bill?
Thank you, Honorable Chair. Thank you, Honorable Minister. And with your kind permission, I will stand on the existing protocol already established. I'm very delighted to hear some of the cogent reasons why I sponsored this bill. That's the bill for the establishment of the National Blood Service Commission. I want to share an experience that inspired me to take this noble direction. My daughter, who is now 28 years old, and who incidentally is a sickler, occasionally, whenever she had crisis, require blood for her to actually be revived. And about 10 years ago, in such kind of crisis, she was administered with blood that was infected. And the resultant effect is that she has a hepatitis B that she has been living with to this date. It was much later, after she tested positive to hepatitis B, that I came to realize that the cause of that was a bad blood that was transmitted to her while she was on a hospital admission. And that is the reason why I said, this story that my daughter is facing, which I believe is a story that so many other Nigerians, thousands and thousands of Nigerians are facing, should be taken up strongly. Because unless we take the issue of blood transfusion seriously, more and more people will suffer and more people will die. I was privy to the statistics of the blood transfusion administration in Nigeria, and I was amazed and sad to find out that Nigeria, being the giant of Africa, is incidentally one of the most backward when it comes to the issue of blood transfusion and administration in Africa, not to talk about the world. So the statistics is very gloomy from all aspects that you look at, from accident-prevented fatalities, which from time to time require blood on emergency basis. A lot of people die because blood is often not available to assist those patients. Likewise, on the issue of maternal mortality, that is one area that Nigeria is even ranked almost number 150 something in the world, because more and more women die because of blood loss during child delivery, and because the blood wasn't available to actually assist them to get better. Again, we realize again that safe blood is another critical area that this country has not been able to do much about. Honorable Minister has just mentioned it, and I have just given an example of my own daughter, who is a living victim of such. We believe that with the establishment of a commission that will serve as a regulatory agency, such kind of avoidable deaths, avoidable sufferings, and improved service delivery will be attained by Nigeria. And that's the reason why I felt obliged to sponsor this bill, so that Nigeria and Nigerians will have a better life.
So we want to call on the the coordinator of blood transfusion to just say 1 or 2 words, because the minister has already stated your position.
Thank you, Mr. Chairman. Like you have said, my minister has already made all the issues known. However, in respect to what my Honourable Minister of State has just said, to add the fact that the National Blood Service Commission will be able to stand on its own. Thank you, Mr. Chairman. What I was saying is that in addition to what my Minister of State has said, it's anticipated that by the time government establishes commission, the commission should be able to sustain itself after some times, and therefore the issue of funding will not be a problem in having the commission in place on a long-term basis. Thank you.